Greetings for all the teachers here and to our fellow student of Pasita Complex Senior High School. And what we're going to discuss today is our prepared concept paper entitled Experiences of COVID-19 Survivors from PCSHS during the Omicron surge in January 2022. And to introduce my fellow researchers in this concept paper, they are Christine Jane D. Agsaway, Hazel Ann A. Ayapana, Don Charles I. Hardinero, yours truly, Francesca Rizzi R. Prasaya, Anne Margaret V. Ravello, and lastly, Alexa H. San Jose. And we are the Group 8 of 11 Banatao in Practical Research. We are now going to research gaps of this concept paper. So let us proceed. Research gaps. Omicron is another variant of COVID-19. On January 15, DOH or Department of Health confirmed the local spread of Omicron variant in the Philippines. Many Filipinos have experienced the Omicron variant. It is really a serious case to talk about and a lot of Filipinos don't know the experience of having a virus like this. Some people might wonder, how do these survivors live their life while struggling with the virus? This study reaches out students and other people to know what they felt during these times of being sick. This research study aims to know what lies behind the people, students, and youth. How do they conquer being alone in quarantine facilities? What adjustment they do in order for them to survive? What motivation they do to fight this battle? This may help you to unlock your curiosity in mind. Also, this research study aims to fill your mind with information with more than a two heads being combined. The Omicron variant of COVID-19 has been called a variant concerned by WHO or World Health Organization. Omicron is spreading faster than any previous variant with doubling time of 2 to 3 days. After analyzing and reviews about some previous research related to this topic, only the numbers of survivors in COVID-19 is what they focus at, and no study or research has been answered on what they really encountered during this Omicron surge. This research study aims to gather information of some experiences of COVID-19 survivors, especially in PCSHS, during Omicron surge and include other informations to fill the gap related on this topic. That's all in research gaps. Let us proceed now in our objectives of our concept paper. Proceed.
Thank you so much, Mr. Aburan, and for the research gap and for the objective one. This research is to stay informed the locals about the fake news about COVID-19. People that tend to be informed felt more resilient and felt better able to handle the virus. It may also lower levels of stress, anxiety, and depression in people nowadays. In our community, we all play a crucial role by washing our hands, wearing our face masks, and taking vitamins. We can lessen the chance of spreading this infection is not just for ourselves but also those around us. By following this routine every day, we can gradually eliminate the viruses. Next. For the second objective, this research aims to collect the data about the experiences of a COVID-19 variant survivor to inform the readers about how and what to do when you have COVID-19 and list the symptoms that you might have when you get the Omicron variant. We would like to know and list all the experiences of a COVID-19 Omicron variant survivor, hence that we could share the data that we recorded to those who will read our concept paper. Next. And for the last objective, COVID-19 vaccination is a safer, more reliable way to build protection. This objective is to encourage people to become vaccinated to COVID-19. COVID-19 infection can lead to serious disease or death. We have no way of knowing who will develop a mild or severe sickness. Antibodies in vaccines help to strengthen our immune system. Those who do not have protection or immunizations are at risk of contracting COVID-19, which can have catastrophic implications. Furthermore, The World Health Organization or WHO promotes vaccination as the best COVID-19 protection. Thank you. Now that I have discussed the objectives, Ms. Sanase will now discuss about the where is the setting of this topic and who are the
Thank you for that, Mr. Hardinero. For setting and participants, this research will be taken at Pasita Complex Senior High School or PCSHS. The participants of the study are primarily the survivors of COVID-19 Omicron variant in January 2022 in PCSHS. With this in mind, the majority of the participants will be covered by grade 11 ABM. These participants are the individuals who met the criteria of diagnosis of a survivor of Omicron surge. This research will be taken at Pasita Complex Senior High School as one of the most important establishments for education in San Pedro City, Laguna. Along with other schools and universities, Pasita Complex Senior High School has become one of the most affected during the surge of Omicron variants from January 2022. As it was mentioned in the title approved, data will be collected in the said school. The participants of the study are primarily the survivors of COVID-19 Omicron variant in January 2022 in PCSHS. They will be chosen according to the Department of Availability, wherein the percentage will be gathered after the said victims agreed and showed up in the research. With this in mind, the majority of the participants will be covered by grade 11 ABM. These participants are the individuals who met the criteria of diagnosis of a survivor of Omicron surge. Anyone who still has the said illness will be excluded for the safety of everyone. Then for the theoretical framework, there are 3,627,548 Filipinos recovered as of May 30, 2022. Here in our region, in NCR, there are 1,160,449 as of May 30, 2022 by Department of Health or DOH. There are threefold solutions. First is to strengthen health systems resilience. Second is bringing health services closer to the people through universal health care or UHC. And last one is to invest in pandemic preparedness and response by World Health Organization or WHO. This research is about the number of Filipinos recovered in COVID-19 during this time. According to the Department of Health or DOH, there are 3,627,548 Filipinos recovered as of May 30, 2022. Here in our region, in NCR, there are 1,160,449 as of May 30, 2022. As emphasized by Dr. Celso Wate of the Medical City and the Victor R. Potenciano Medical Center, they said that this is the end goal of psychiatrists in providing rehabilitative care and treatment. According to the World Health Organization, there are threefold solutions. First is to strengthen health systems resilience. Second is bringing health services closer to the people through universal health care. And last one is to invest in pandemic preparedness and response. On the other side, there is Dr. Edsel Salvana, Director of the University of the Philippines Institute of Molecular Biology, said that the novel coronavirus is not uniformly fatal and that recovery is more likely than dying from the disease. And lastly, Ms. Agsaway will continue the last two theoretical framework.
Thank you so much, Ms. Sanasa, for the two theoretical framework. And the last two is, as of date, there is five, five deaths among confirmed Omicron case, while the total number of confirmed Omicron variant cases now 1,153. The additional 35 Delta variant cases were 26 were local cases and 9 were ROFs. Based on the case line list, 1 case has died, 30 have been tagged as recovered, while there are 4 cases whose outcomes are still being verified. The total number of confirmed Delta variant cases now 8,647. Then for the last theoretical framework, the Department of Health, the University of the Philippines, Philippine Genome Center, UP, PGC, and the University of the Philippines, National Institute of Health, or UPNIH, reported data of the 677 sample sequence, 618 Omicron variant cases, and 35 Delta variant cases were detected in the latest batch of the whole genome sequencing. There are differences opinions about the recoveries in COVID-19. Last January 20, 2022, the number of persons recovered represents COVID-19 confirmed individuals with an onset date on or prior to December 2021. During the Omicron wave in January 2022, we saw a massive surge of COVID-19 cases. Fortunately, the risk of hospitalization and deaths were lower, but that should not cause us to hesitate from getting COVID-19 vaccinations, including the booster doses as required. That's all for theoretical framework. And next, so the references we have used. Next. And lastly, I am Christine Jane D. Agsaway, Hazel and A. Ayapana.
I am Ron Jose Hardinero.
I am Christine Jurabulan, Francesca Risi Pesaya, and R. Margaret R. Ravelo.
And I am Alexong Salazar.
Next. And now that we have determined what are the research gap, objective setting, and participants, and the theoretical framework, and propose our concept paper about the experiences of COVID-19 survivors from PCHS, PCSHS during the Omicron surge in January 2022. Lastly, we would like to thank Ms. Suarez, and we do hope that each of us have benefited from this concept paper. Thank you so much and have a great day.